My name is Kayla Denny, and I'm doing a speech on how to draw blood and run a heartworm test on a dog. So heartworms in South Texas are very deadly. They're given by mosquitoes. Most people have never heard of them, and they can actually kill dogs that have heartworms. Heartworms are actually worms that slowly fill the heart up and slowly suffocate it. And then, so some facts on heartworms are given by mosquitoes. 1 in every 10 mosquitoes can carry the heartworm virus. And then if a mosquito lands on your dog, they can insert the heartworms into the dog, and then the worms can start to breed in the dog if not on preventative or treatment for it. Dogs can be tested as early as 6 months of age for this, and then you really should get your dog tested for it. And it can be treated if they do have heartworms, they can be treated for the heartworms. So the supplies you're going to need is you're going to need 2 people, yourself and a helper. You're going to need alcohol spray. You're going to need conjugate, which is a mixture you mix the blood with. You're going to need a needle, a syringe, a vet wrap, a sample tube, and gauze. And you can find all these usually at your local store or a feed store, and you might need to go to a vet supply office for the actual SNAP test you're going to need to run the heartworm test. And then your first step is going to be we're going to actually draw the blood on the dog. So you're going to have one person hold the actual dog, probably more in a headlock position. You're going to have them hold the paw out and then the dog around the head so it's not able to get aggressive with the person drawing the blood. And then you're going to have yourself hold the paw to where that you have control over it so he's not able to yank back every time that you're wanting to stick the needle in. And then you're gonna occlude the vein. Your helper is gonna actually put pressure onto the vein, the cephalic vein, and then that will hold off the blood in it. And then you're gonna get alcohol spray and spray the area that you plan on drawing blood from to make sure it's sterile, that you don't get any bacteria, doesn't get any infection after you draw the blood. And then you're going to insert the needle into the cephalic vein. And then a little bit of blood should enter into the syringe, and when you see that little bit of blood enter, you pull back on the plunger to get more blood out. If you don't see any blood come in, you can pull a little back bit and move the needle around, but then if you don't get any blood then pull it out again and move upward on the arm. But by that time, if you move upward, spray the air again with alcohol and then insert the needle again. And then this is how it should be. So this is a tourniquet. If you don't have a helper, that's the next best option. That'll hold off any pressure you see mostly on yourself when they put it up here and stop the circulation from the blood going through. But you can also use it on a dog. And after the blood is drawn is actually where we're going to get all the supplies that we're going to need. There's a sample tube, that's a conjugate, and that's the SNAP test. So you're going to get the sample tube and you're going to drop 4 drops of the conjugate, which is a blue liquid, into it. And then you're going to get 3 drops of the blood and put it into the sample tube and close the tube, and then you're going to mix it very well. That'll usually, if you have an inverter, you'll put it on there and I'll spin it just 3 to 5 times, but mixing it with your hand is just fine. And then after you mix it, you're going to open the tube and you're going to actually get the SNAP test. This is what a SNAP test looks like. So that's a sample well. You're going to pour the contents of the sample tube into the sample well, and they're going to flow down through the result window, and to the activator window. Right when you see the sample content get to the activator window, you're going to snap down on the activator right there and make sure that it's flush level with the actual SNAP test. So, and if it doesn't go down all the way, the test would be inaccurate. So make sure you press down all the way. And what the contents are going to do is they're going to go all the way back up, and then give it 8 to 10 minutes to allow the test to run. And then these are what you might get. So this is considered a negative test result. It'll be just 1 dot at the top. And then this is considered a positive test result. So most vets would consider that to be a higher heartworm positive dog, but you can't actually tell how high a heartworm test unless you actually get more blood work done by actually taking it to a full service vet to get the blood tested. But you want a negative result, and if a positive result, you need to talk to a full service vet about getting your dog treated for heartworms. So it's very easy to save a dog's life from getting heartworms. Just a simple test can tell you if your dog has them or not. And then you don't want your dogs to get sick with this, because you don't see signs of it, you won't know they have it, it's not something that comes out in their stool. So the only way that you'll know your dog has heartworms if they're almost to the point where there's so many in there, they're coughing it up, and it's hurting them. And then if you don't feel comfortable doing this, you can always take them to a full service vet. Some vets charge $10 to get this done, and some vets charge a little bit more. But otherwise, so this is how to draw blood on a dog and run a heartworm test, and I hope that if you guys have not already done this before, or if you guys are interested in doing it, you get it done today. Any questions?